Hello, my name is Rane and this is the Flow Artist Podcast. Every episode we interview inspiring movers, thinkers and teachers about how they find their flow and much, much more. We're all about yoga, movement and meditation and all of that good stuff that we love to share with the world. I hope you're having an absolutely wonderful day. I'm doing great and cannot wait to get this episode out to you. Before I get into it though, I wanted to talk about some events I've been attending here in Melbourne lately, and that is the Yoga Life Satsangs hosted by Janet Lowndes and Lee Blaschke, two amazing teachers who we've actually had on the podcast a while back. Now, these are great gatherings where we've been delving into the philosophies and principles of yoga, and I've personally gotten a lot out of them. Now, Janet or Lee haven't asked me to talk about this on the podcast. I've just had such a good experience, I wanted to share it with you. And the last couple have held some interesting discussions around cultural appropriation and the privilege we have as Westerners. And some other topics include being authentic as a teacher and really connecting with your students. Now, there's still a few sessions left. I think there's 3 left. So if you want to come along, I can leave a link for that in the show notes. Now, I'm curious though, what do you think of cultural appropriation in yoga, and what do you think we as teachers or even participants can do about it? I'd love to hear from you. You can join the Flow Artist Podcast community on Facebook or comment on our website at podcast.flowartist.com. I really look forward to hearing from you. All right, so about our episode today. This episode features a recorded conversation between myself, co-host Joe Stewart, and guest Melanie Mackintosh. Melanie Mackintosh is a yoga teacher and co-owner of Australian Yoga Academy. Mel was one of my teachers and mentors while I was doing my yoga teacher training there, and she specialises in pre- and postnatal yoga, the topic of today's episode. As you'll hear in this episode, I still get a little bit of anxiety when a pregnant lady walks into one of my classes, but Mel has helped provide me with a lot of knowledge and strategies to help there. Also, Mel is running a 50-hour advanced pre- and postnatal yoga teacher training workshop from the 5th of May at Australian Yoga Academy in Rane, Melbourne. The last I checked, there are still a few spaces left, so I definitely recommend you go to australianyogaacademy.com to find out more, and I'll leave a link for that in the show notes as well. Alright, that is more than enough from me. Let's get on to the conversation with Mel. Alright, Melanie, thanks so much for being with us today. It's so good to get the chance to speak with you. Perhaps you could just start by telling us a little bit about your background and where you grew up.
Well, thank you so much for having me, both of you. So I grew up in Gippsland in Victoria, and moved to Melbourne after I had completed university and been traveling around Europe and those sorts of things, and came to Melbourne in my early 20s and worked in corporate for quite a long time, and that's really where my love for yoga started to come to be. But before that, I'd had no experience in it whatsoever. It was something that I was introduced to by a really good friend of mine.
Oh, so like discovering it as an adult to help you deal with stress from work.
Yeah, exactly. So it was one of those things that I had a really niggly back injury as well. So which is not really an injury, but just one of those niggly backs that I think you get from just sitting at desks all day and not moving, within your full range of motion. And one of my friends had said to me, "Oh, you should come to yoga." And it sounded great because the stress of corporate life can be really quite overwhelming as well.
Any key teachers that you've really helped you along your yoga journey?
Yeah, sure. Yeah, it was one of the funny things. I distinctly remember being in the Dimmick's bookshop on Collins Street, and I was, swanning about in the health and wellbeing section, and I came across BKS Iyengar's Light on Yoga, and I was captivated, absolutely captivated by what he had to say and how he moved his body and the things that he was able to do, and then also this was a little after I had started my yoga practice, but then that was really my introduction to things like the 8 limbs of yoga, So looking at it from a really holistic perspective. So before that, I really had no idea about yamas and niyamas and where asana sat in relation to pranayama and so on and so forth.
From the beginning, like, you're obviously really drawn into the deeper layers of this practice, like more than the physical.
Well, I probably no. Like initially, I think it was very much about what can I do with my body, and just that it made you feel good. When you speak to people all the time, you say, why do you practice yoga? What keeps you coming back? Well, because it makes me feel great. One of my teacher trainees yesterday said it makes me feel like magic. And I thought that was a really beautiful way of explaining it. So, without over intellectualizing things really, you just say, well, it makes me feel good. And that's why I do it. So, and then out of that, I think, came my interest into, those deeper layers.
And I guess that interest into why is this making me feel good more so than just exercise might.
Totally. Yeah, for sure. And I think one of the things is when you don't do some of those things, you realize, as in don't do things like meditation and you don't breathe properly, then you notice the ramifications for not doing. Does that make sense? And then you realize, well, this is why I do this, because it helps to keep me centered, or it helps to keep me balanced, or, more patient, or whatever it might be.
Were those personal benefits the reason why you decided to start teaching, or is there another story there?
Oh, well, that's a good question. I think I'd been working in human resources and change management for a really long time, and I knew that it wasn't, I felt like I was good at what I did, but I just didn't want to keep doing it. It wasn't where I saw myself in 10 years or 15 years time. And I'd started to be involved with natural therapies as well. I decided to study to be a naturopath, and I thought that would be a lovely pairing. Yoga could go really well together. I didn't finish those naturopathic studies, but they've been invaluable for me, putting that together from a yoga perspective.
Obviously now you teach at Australian Yoga Academy and you're actually a part owner there. So how did that relationship begin?
It was a wonderful relationship with Dominique and Anthony when I completed my teacher training there, like you did, Rane. And through that process, I identified early on, and I think so did they, that they would like me to work with them, which I did as soon as teacher training finished. And so that was at the end of 2006, and so I was teaching general yoga classes. And then in about 2008, I joined the lecturing team, so actually delivering the teacher training program. And, that just grew, and my involvement in AYA just became bigger and bigger, and it was what I loved. You just do more and more. And we just all felt like that worked really well together. So in around about 2011, I think it was, I was invited to become part of the ownership team. So so it was just a wonderful, building of relationships.
Nice. And I know they almost describe their teacher training as a year-long interview process. So it's sort of interesting that you both came to that realization that you wanted to work with each other.
Yeah.
And I do wonder as well, what was the jump like moving from sort of teaching general yoga classes to moving to lecturing other teachers to be?
It's a great question and a really interesting one. And I think it just continues to evolve as well. So I don't think that's actually stopped.
Yep.
And we learn so much from the people who come in to work with us from a teacher training perspective. So getting to know the students and getting to know their backgrounds and their stories. And that's continuously colouring how I deliver my modules, and we just have such a lovely time working together and learning from each other. But it can be a little challenging sometimes too, especially perhaps when you don't see, not eye to eye, but you don't have consistent views. But that's part of being human. It's okay to disagree.
Yeah, absolutely.
And so do you mean like with the other people who are teaching some of the other units, or with the teacher trainees themselves?
No, I think, and when I say disagree, it's not really a disagreement.
Just a
it's
different
more
point
about,
of view.
Yeah, we can see it from different points of view, and our own experience again really colours how we teach and where we come from. And that's great, because it's really diverse and it's a very respectful environment. And sometimes there'll be a situation, where as a lecturer I say, no, we're doing it this way because here's why, but then understanding that people bring their own experiences to the table as well.
And there's definitely a lot of traditional yoga texts, like say Light on Yoga, where there's some really firm opinions.
Totally.
And there are lots of different points of view around alignment, and even if there is the right alignment that will work for everyone. So I think it's like a really powerful part of the learning process, just to learn that there are lots of different points of view and there's no one right thing that's going to work for everyone.
No, it's a really good point. And my background was very much in the Iyengar space. And, I think a lot of people would look at the Iyengar yoga tradition as being quite specific, very much from an alignment perspective. We use the props to do this. If you don't achieve, let's say, the posture so it looks this way, we alter it or so that it looks right. And I guess where I've come from over the course of my teaching journey to where I am now is I'm not interested so much in how it looks, but how does it feel? It's got to be about that felt sense. So that's really where, from an evolution perspective, where I was to where I am now, and I'm sure in 10 years' time that will be different as well. But for me, right at this point in time, it's how does it feel?
And you would have another layer of this, because I know prenatal yoga and postnatal yoga is one of your specialties. And there's even more contradictory points of view when it comes to prenatal practice and postnatal practice. And
very much so. And I can admit it's really confusing. It's confusing for me. It's confusing for the students. It's confusing for when I'm teaching the teacher trainees and they pull out let's say a traditional text and they say, but the text says that this is okay. And we say, but how does it feel? And who was the target audience at that stage? Were they people who were perhaps practicing yoga every single day, as opposed to the modern Western female who is sitting perhaps at a desk most of the time and coming into a class once a week? So that's a really different story, and people in those situations have different needs.
Was it through your own pregnancy that you discovered prenatal yoga and discovered your love for it?
Completely. Before that, people, the prenatal students would come into the class and I'm like, oh God, please go away. I was so worried about, injuring them or being in a situation where I was putting themselves or the baby at harm and not knowing. So yes, through being pregnant myself and practicing, during my pregnancy, I gained a lot of confidence in then actually establishing prenatal classes at AYA, and they've been running ever since 2010.
And I do feel that your prenatal teaching does come from a real lived experience, obviously, because I feel your take on it is very restorative. And as a man, I guess I can only imagine the discomfort and, other, I guess, I don't know if I'd call them problems, but
challenges,
yes, that are associated with pregnancy. So it's really beneficial for me to have your perspective on that.
Oh, no, it's again a good question, and I think that as having been through 2 pregnancies and delivering 2 babies, then of course I have a level of experience that I can bring to my teaching, but at the same time, even pregnancy to pregnancy, they're so different, and person to person, they're so different. And so it's great that I've got that experience there in the background, but it doesn't mean everything. And I'm really very aware of some lovely prenatal teachers who've never had children, and even some fellas well, who are quite comfortable teaching prenatal students. And so I don't think it's everything to have actually gone through that experience yourself.
I, for one, I still feel a bit of anxiety if I see a pregnant lady come into my class. In one of my classes, there is a young pregnant woman who she just knows what to do. So I can actually not worry about her too much and just sort of give the occasional option if I feel like she needs it. But I was wondering if you've got any advice for people who might be feeling that anxiety when a pregnant person comes into their class.
Yeah, well, it's a really understandable feeling to have. Like I said, I felt the same way. And I think probably the first thing is to think when you're first speaking with that student, if they have any major concerns, I would imagine from a pregnancy perspective, I would imagine that they wouldn't be in a general yoga class. I imagine that they would seek out a dedicated prenatal teacher. So we probably have to assume and take from what they're telling us that if they're feeling really good and things are going well and there's no major concerns, then they're a lot more robust than we actually think they are. So, I used to say sometimes, I'm pregnant, I'm not dying, so it's okay. But that, coming from the perspective of being a yoga teacher and being presumably quite body aware, and that's also an interesting point too, I think, when you have students who have been your students before they fall pregnant, that's a very different story in comparison to the people who walk in the door for the first time at 25 weeks pregnant or 12 weeks pregnant, whenever, saying, "Hi, I'm pregnant. I've never met you before. My doctor said, or this person said, I should do some yoga." And so we probably have some more questions to ask that person.
And it is quite common that people, this will be their first yoga experience because once they get pregnant, they want to start taking really good care of themselves, or maybe they are starting to get some aches and pains. So I have definitely had many students who it's their first pregnancy and it's their first yoga class. Yeah. So everything is new.
And it's a big challenge because they're not used to moving in those directions or creating those shapes with their body. Perhaps they haven't been doing very much exercise. Maybe they have, and that can, the people who are quite physically active, a prenatal practice, especially as I teach it, as you said, run quite from a restorative perspective, can be a bit of a challenge for them because they think, well, when are we going to start moving? So I guess one of my approaches to the students that I meet for the first time when they're joining us in practice for the first time is to ask them, what do you want to get out of your practice? Because that helps me to decide and to guide them. So occasionally, my recommendation for them is to go upstairs and do a different class. Because based on what they're telling me they want, it might be that they don't get that in prenatal. But they might change their mind as well. So the door's always open for them to come back down into prenatal and to blend the classes together. It doesn't have to be an either or situation.
I think it's really nice as well to begin your relationship with them with giving them a bit of autonomy, because I'm sure when you are pregnant, there's so many people telling you what you should and what you shouldn't do that it would get very
really
overwhelming.
Emotive. Yeah, definitely. There seems to be a lot of pregnant women say, what's happened? Suddenly I've become public property and everybody wants to touch me and everybody wants to tell me their stories and all of these sorts of things. And so, it can be very overwhelming, especially when you're going through it for the first time.
Are there some core principles of prenatal yoga that you really bring into every practice?
Yeah, with the way that I teach prenatal, and this will be different teacher to teacher. So I'm just coming at it from how I teach, but my biggest focus is really on working with the ladies to understand that they have the capacity to control and to drive their nervous system, and that's primarily through the breath. So we always will start with some breath awareness, whether that's just relaxed abdominal breathing or whether that's ujjayi work, or perhaps there's a method of breathing where it's almost like a sigh on the exhalation. So they make breath with sound. So it's a soft ha sound, for example, that beautiful opening of the mouth and just letting the sound come out with an elongated exhalation. So there'll always be that side of things in the practice. And it's important to me to explain to them that the reason that we're doing this is because dysfunctional breathing will have a big impact on your nervous system. But the good news is that you can identify that. So let's work through what some of those signs might be, and you can identify that and then use your breath to bring things back into under control, or to that, equilibrium state that we're looking for.
I saw this other study that there's this really powerful correlation between your stress levels and your pain levels.
Yeah.
And even, I'm sure it would be for birth as well, but even if there's any kind of pelvic sensitivity going on, the women who reported the most pain were not necessarily the women who had the most damage.
Yeah.
It was the people who were the most stressed. Yeah. And that was a much bigger correlation than the actual MRI would show.
Yeah, exactly. And there's been a lot of studies to show that, to quite an extreme, very extreme. For example, there might be somebody with a bulging disc within their neck, which, for all intents and purposes that person should be experiencing a significant amount of pain, yet because how they're managing their mind-body experience, they're not experiencing it to any, where near the level that people would be expecting them to. So similarly, from a prenatal perspective, going through the pregnancy, going through the birthing side of things, again, our scientific studies that we've got available to us now are showing us and telling us that through our holistic yoga practice, things like perceived pain scores are lower back concerns, discomfort, leg and hip issues, and so on and so forth, is the perception of the pain is greatly reduced.
And I guess as well, experiencing that in a yoga class would be a really good confidence building and experiential practice of bringing that awareness right up to the birth. So having that, it's like a microcosm of how you can use your breath to manage the sensations in your body and kind of experience that mind-body connection that would just be so powerful when you're moving towards this really massive event.
Yeah, and sometimes I liken it to running a marathon and I explain, we talk about the fact that, if I decided to run a marathon in October, I'm not going to decide in September to start training for it. I presumably would be doing a lot beforehand and preparing for the birth that you're hoping to have and working towards. It, needs, for many of us, not everybody, but for many of us, it's helpful if we start that preparation early. So that could be around understanding the role of the nervous system and how the breath intersects that. It could be about starting to cultivate states of santosha so that from a contentment perspective, we start to be flexible between our two ears. Yeah. So if the birth doesn't go how I would like it to go, am I going to tie myself up in knots about that and think I'm a bad mother? These sorts of things. And then from a physical perspective, because there is a physical element obviously to the practice as well, and I'm a huge fan of the active birthing movement where in the 80s a lady by the name of Janet Velasquez really introduced active birthing as a direct countermeasure to the active controlled birthing situation that was happening at the time. So controlling birth down to 12 hours. There's actually documentation to say let's control birth to 12 hours. That's ridiculous. But
is this based on doctors' convenience?
Yeah, totally. Yeah, it would be about, things like, let's make sure that we can be convenient for everybody. We can tell the mother, well, between now and here, your baby will be born. And that life doesn't work that way. So she was instrumental in sort of bringing and giving the power back, or empowering women that they were responsible and they were in charge of their birth, and it wasn't going to be something that was necessarily medicalized and driven by somebody else. And so the active birthing movement really highlighted that certain physical positions were so helpful to birthing. So from a yoga perspective, a lot of those positions are emulated in yoga postures, and sometimes it's just more about mobilization and increasing range in, let's say, ankles and knees and hips and so on and so forth to make birthing as easy as possible.
Because I'd read this in multiple places, lying down is a terrible position to give birth in for a woman, and it's only for the medical team's convenience that was ever a thing.
Exactly. So if you look at, often I'll say, let's look at what happens in the natural world. Let's look at what's happening, in third world countries, or where birthing is not medicalized. Which woman in her right mind would give birth on her back? Now, having said that, I have come across a couple of women who said that was what was comfortable for them. So if that was comfortable for them, fine, that's their birthing experience. But for the most part, when you lay on your back, your tailbone curls up and under, it closes off the pelvic outlet. So baby almost has to go uphill before they can come out. This is not helpful. This is, we're not using gravity to our advantage. We're not able to move as much. And then aside from all of that, what's happening to blood flow to the baby and to the uterus? So there's a reduced rate of blood flow both to the placenta and to the fetus. Not helpful.
Well, yeah, that's one of the contraindications for prenatal yoga. Exactly. Don't lie on your back for too long.
Exactly. So, we know that if someone was pregnant and they ended up in emergency for whatever reason and they needed to be treated on their back, they would raise the right hip up to reduce that vena cava compression. So that happens. Sometimes that does happen. And occasionally you will have somebody, even in a very advanced pregnant state, say to you, I feel really comfortable on my back and I'm not experiencing any of those signs of discomfort that you're talking about. Dizziness, nausea, difficulty breathing, those sorts of things. So on the one hand, you have to say to yourself, well, maybe that's perfect for that person, and it can be a lot to do with where the baby is positioned, and they move all the time. And so I might say to somebody in that respect, well, that's okay for you right now, but just make sure that you check, next time you come to be on your back, because baby might move and your experiences might be different.
I've had people come to my class who said, like, I go to sleep on my side, but I wake up on my back. Like, could I be hurting my baby?
Yeah, it's really normal. People, they can get a little panicked, like, oh no. You know what? I really think that if there was an issue, your body would send you a really direct physiological sign to move. Yeah, that's a little contentious. There's some people who say that maybe blood occlusion is happening even if the mother doesn't feel it. Instinctively, I just can't see that happening. That's my instinctive, not scientific opinion. but yeah, so I've had similar situations where people have gone, oh no, I'm on my back when I wake up. You know, am I damaging my baby? So,
and also the reduced blood supply, it's to the mother, not the baby, right? Like, it's to the mother's
both.
brain.
Yeah,
I guess it is both because they're so connected.
Yeah, it's both. So the blood flow is being restricted to the mother's cardiovascular system, and if the mother's cardiovascular system is impacted, then clearly the baby's will be, as you know, the delivery of oxygen to the baby is going to be impacted as well. So it's probably not a great idea, let's say from 20 weeks onward, or if you feel it beforehand. And a lot of people feel not even on their back, they might be slumped in an armchair or like a deck chair or something along those lines, or they're in a comfy chair at home, or even, you know, sitting on a plane, something along those lines, and they'll start to feel a little odd. And it's just a prompt. Let's move. Need to make more space.
Hello, Rane here, just popping back in to talk about our Patreon page. Yes, Patreon. Patreon is a way where you can support our podcast from as little as $1 a month. Just $1. Higher tiers get great benefits, such as shout-outs on the podcast. This week, I'd like to thank Janet Lowndes for joining the party. Thank you so much, Janet. Some of our supporters also get access to extra content, and speaking of which, we've filmed a short bonus video with Mel, and that will go up on our Patreon page in about a week or so. And last week, I put up a short video with Emma Kenner talking about how she navigates the perilous seas of social media. So go and check that one out. We were able to transcribe our recent episode with Amy Wheeler thanks to our Patreon supporters, and we are incredibly grateful. We should have enough funds for another episode soon, and we'll put that up for a vote. Which episode should we transcribe? Now, if you'd like to learn more, just go to patreon.com/flowartistpodcast, and I'll leave a link in our show notes. All right, let's get back to our conversation with Mel.
And so I guess that's brought us to the first one of those difference of opinions, different points of views that there are so many of as to what's helpful and what's not helpful in prenatal yoga. I'd love to ask your point of view on another one, because it's a real opposite sides of the coin in terms of what's recommended. Some yoga styles are all about hip opening postures, creating space to prepare for the birth, and other styles are all about cultivating stability and strength in those muscles and not doing any of those wide leg open forward bends.
Yeah,
What's your point of view?
Well, I think it depends. You know, it depends on what's going on for the mother. So my overarching comment on that is I don't think we need to have an over presentation within any of those practices that is all about just hip opening. There's no need to overdo the hip opening. The body's going to be producing a good amount of relaxin, the hormone, which will help to soften those joints and ligaments to make the passage of the baby a little bit more easier, more freer. It allows the bones to move and those sorts of things. And so where I feel cautious about that is that a lot of people who come in, a lot of mothers who've been practicing for quite a long time, who maybe are already quite flexible, they don't need any more flexibility. That is destabilizing. And that might contribute to things like pubic symphysis pain, pelvic instability, or sacroiliac joint dysfunction. They don't need any more movement. It is actually helpful for them to contain and to develop some strength in and around those areas. And one of the biggest things that we can do in our standing postures, for example, like Virabhadrasana 2 or Vira 1, is to make sure that the glutes are really active. Yeah, so keep those glutes really on and firing so that the lower body is supported. The muscles in and around those pelvic joints are really kept stable.
I find, because I do Pilates as well, and glutes are something that I really love to work on with my prenatal clients because all of the strong abdominal work is not really going to be helpful for them anymore. But they still want to feel strong and powerful and active as they move through their pregnancy. And also, if they're starting to experience a bit of lower back pain as their shape changes and their balance changes, the glutes are such a useful area to work on to help with all of those things.
Yeah, totally agree. And also the drawing of the belly and the baby in. Sometimes I talk in general, or in not so much in general class, but in dedicated prenatal class about feeling almost like you've got your arms around your baby and you're drawing your baby in towards your spine. So you're reducing that sway back effect because, as we know, the spine shifts and changes its presentation throughout the pregnancy. And part of that's just about balancing out the weight of the baby that's pulling you forward tends to tilt the pelvis forward. The bottom sticks out behind us. So we, need to sort of contain that in and draw. We're not really drawing in belly muscles, particularly in the latter stages of pregnancy. They're sort of a bit uddiyana. What's that? Can't find that anymore. But that feeling of just drawing in and being contained is helpful.
Yeah, I actually use the cue like gently hugging your baby in.
Yeah, similar.
And that actually brings me to another thing to be cautious of with a prenatal practice, because I have read that too much focus on abdominal work, even in the early phases, can contribute to rectus diastases because those muscles are more tight, so that area is not as flexible.
There's no correlation between how tight your abs are, whether you've got a six-pack or not before you fall pregnant. There's no correlation between that and whether your rectus abdominis will separate during pregnancy. The statistics are about 70% of pregnant women experience some level of separation, and it's really normal. It's not harmful to them. It's not harmful to the baby. Occasionally I have come across someone who has said that they actually felt that occurring, generally through a back bend. Now, I remember even myself when I was in postures like up cat, down cat, just on all fours, just inhale, looking up towards the sky, arching my back, that during the latter stages of the pregnancy, I could really feel that shearing. So rectus abdominis, it attaches at the sternum and also at the pubic bone. So as baby starts to grow and the uterus expands, then that in itself is a stress, if you like, on those belly muscles. And when we go through especially gravity assisted back bends, so where the belly's being pulled towards the ground, when we're on, let's say, in chaturanga for long periods of time, those sorts of things, they can and also twists. So really know that twists are one thing that we obviously, closed belly twists we take out of the equation quite early on, but twists can contribute to that separation as well. So it's not to say that you can't do any back bend in pregnancy, but it probably needs to be pulled back. Sometimes a lot of women like that just from a chest opening perspective. They are able to open the chest, throw the collarbones back and feel quite expansive across the front of the chest because breasts start to get quite large and heavy and they start to feel like they're being pulled forward. So that can be nice. So we just approach it slowly.
That's so interesting, actually, because when I've done prenatal Pilates training, they were saying that curl up flexion action is actually the action that separates rectus abdominis. So I guess it's just too much movement in any direction and feeling like you're pulling on those muscles as you move.
That's right. So when we think about a sit-up position, for example, which we might experience from yoga in postures like Navasana, boat pose, for example, and it's a really clear, when you look at somebody who's pregnant, it's really clear if they were on their back, knees bent, soles of the feet onto the floor, and they do like a little mini sit-up, and you can see if the belly is tenting or doming, it's an indicator that the abdominal muscles have started to separate and the organs underneath are starting to be pushed forward, almost like a hernia, in a way. So I think two things are there. The expanding of the uterus and the growing of the belly encourages the separation, and then the sit-up type positions can exacerbate it even more.
And obviously we probably wouldn't be giving these positions to people as exercises in class, but it's also a position that you might use to get up when you've been lying down. Exactly. So even if it's not an actual posture, it's the transitions as well that are important.
Yeah. So a lot of what I go through in prenatal is a little bit about day to day. activities that will support where they're at in their pregnancy. And exactly, that's a really key one, coming up from, let's say, if they've been in bed and they're on their back, that they don't jackknife forward to sit up, that they roll over onto their side. It's something that I go through in prenatal when they're coming out of Shavasana, for example, or that they roll to their side. Anytime they've been on their back, they roll to the side and use their hands and their knees to press them up. Other day-to-day movements which might contribute to issues that they're experiencing in pregnancy could be particularly in the areas of the SIJs, the sacroiliac joints. That's a really common area to feel discomfort. So I might sort of talk to them about, well, how do you squat down onto the floor? Let's, instead of it being a parallel foot squat, let's stagger the squat, 1 foot forward, 1 foot back. And then this helps to keep pelvic floor stable, especially when they come up. So not too much low squatting in, let's say, a yogic squat. Don't need to do that. Be careful as you come up. Be careful how you get into and out of the car. So pretend you're a royal, pop your bottom in, then swing your legs in together. And getting out, same thing, knees together, swing the legs out. These things will help to just contain some of those tricky areas.
And squats was something I was going to ask you about as well, because often that would be people's first go-to thought if they're like, right, I want to strengthen my glutes. How do you feel about squats in a prenatal practice?
Yeah, well, to start off with, when you're in a squat, the glutes are stretching, they're not contracting. So, it's the standing up where we get the contraction happening. And there is a school of thought which says that particularly if it's a parallel foot squat, you stand up, it's difficult to maintain pelvic floor awareness as you do that. So you're carrying a significant extra amount of weight, and then you're going to ask maybe a musculoskeletal framework that is not as stable as what it has been in the past, because relaxin has really started to impact the skeleton. But you're going to ask an unstable skeleton to support a big weight as it's bearing weight, and none of that is a good idea. So squats, I think, can be good if they're supported. I don't have any issue. I think they can be really helpful, particularly about increasing that mobilization in hips and in knees and ankles, if that might be a good position for them to explore during birthing. Yeah, so not a lot of us are happy squatting down on the floor if that's not been part of our regular day-to-day movement. So they can be good. I'm happy to do it, but I like for it to be supported.
I think it's great as well if maybe that's the position that a woman does want to give birth in, to bring in some movements that can activate those muscles in a less complex way and a way that doesn't necessarily involve as much full body balance and so many other things happening.
Yeah. And I think also too that having really significant preconceived ideas about this is how I'm going to give birth. I'm going to give birth squatting. Well, that might happen and it may well, but during the course of the labour, you're probably going to move quite a lot. Most women that at least I've spoken to and my own experiences as well, is you don't tend to stay in one spot. Moving actually feels pretty good, when you're going through labour, for a number of different reasons. But yeah, you might give birth squatting, but you might only be there in interim periods, maybe.
Not going to squat it out for like 23 hours.
No, I would be very impressed. Very, very impressed. But then also too, like you have a look at Janet Velasquez's book, Active Birth, has got some little bit scary 1970s photos in there. But you have a look at the women who have given birth in those particular photos in a squatting state, and they're generally being supported by somebody. They're generally someone standing, one or two people are standing behind them, sort of hooking their arms underneath the woman's arms so that they can really relax and let go. And so that can be lovely. But, there's a constant ability to, and this is why, and another one of the things that I try to really focus on in my prenatal classes is, let's find positions that make you feel good. Let's move from all fours to, let's say, an extended child's pose to a squat or a half squat. A half squat's actually really quite nice, where one leg's bent back behind you, almost like in a half virasana, and the other knee's pointing up to the sky. That can be a really nice supported position, and just as nice for opening through the pelvic outlet area.
What about inversions? Because I know I've seen a picture of the lovely Dominique Salerno in a headstand whilst a few months pregnant. So I assume that she is absolutely fine to do that.
Yeah, and I too enjoyed headstand during my pregnancies as well, but I think that is a depends. It really depends. It depends on where you're at in your practice. So if somebody came into me who had never done yoga before, then this is not the time for us to start practicing headstand, of course. But if you've got a really developed practice already and you're really mind body aware and you can get into things safely and supported as well. Occasionally I have very experienced yoga teachers or yoga practitioners coming into a general class and they still want to do some practices like, quite extreme inversions, and depends on who they are, will depend on whether I'm comfortable with that, and I would generally prefer them to be either me spotting them or having them closer to a wall. But that's the extreme side of things. So it can work, but if I was giving advice to a yoga teacher trainee, I would say that it's probably best to avoid those sorts of things in your classes, just from a risk perspective. It's a little risky. What a pregnant woman does in her own time is her own business. And if she's working with a teacher that's really happy for her to do those things and knows that she has a really strong level of mind-body awareness, then it might be okay. But then we look at things like, well, where is she at in her pregnancy? And if she's quite far along in her pregnancy and baby is engaged, then tipping yourself upside down, not a great idea. Yeah, because you're moving in the opposite direction. Baby's head down and engaged, let's leave baby there. So being in inversions from that perspective for, whatever the inversion might be, even downward facing dog for long periods is not necessarily fantastic because they're already where they should be. Yeah. On the flip side, if baby's in breech, being upside down is maybe helpful. Yeah, so we find, not necessarily a headstand, but other ways of bringing somebody into that forward presentation, which might help baby do a bit of a backflip.
And so this is definitely an area of using your words mindfully. How would you express it if you had someone in your class and maybe you were teaching a range of people, like not just prenatal, and you gave a few options and one of them was a prenatal option, and then say the other one was something like a forearm balance or a headstand, and the pregnant member of the class wanted to do the other option, which you did not feel was safe for them. How do you balance giving them that personal autonomy, it's their body, it's their practice, with expressing, it's my class, I'm responsible for your safety, I don't think you should do this pose?
Yeah, I think that's a really important point, and it's going to depend a little bit again on the student, and this is my feeling on the matter, the student and my relationship with that student. So again, if I feel like they have a good level of self-awareness and they don't have any issues around things like that their blood pressure is good, because that would be another issue. Blood pressure can be quite elevated during pregnancy. So if that was the case, then, going into an inversion, in addition to the stuff that we've just spoken about, would also be an unwise thing to do. So if I felt like everything physiologically and emotionally was right for them, then okay, as long as I was there to support them, then I might be okay with it. But if I had any reservations whatsoever, then I would say to them, I'm really uncomfortable with you doing that. Can you please stop? Occasionally, and this does happen, occasionally people will just go along their merry way and do whatever they like. So that's tough. That's a really tough position to be put in as a teacher.
And sometimes people will just say, well, my doctor told me I could do this.
Yeah. And so I guess, from that perspective, if you feel really, really strongly about it, then it has happened to me in the past. Not very often, I have to say, but it has happened, once or twice where I've said, I'm really uncomfortable with you doing that. I've asked you to perhaps let's take a different option, one that I feel is safer for you and for the baby. And if you're not going to be respectful of my job as a teacher, then maybe this isn't the class for you. And I think within our rights to say that for anybody who has a special need. So if somebody has a back injury or a knee injury or whatever the case may be, and they insist on doing, Padmasana, lotus pose, I'm like, well, it's not perhaps a good idea if you've got a knee injury. Does it feel good? That's the other question. So that's the other side of it, with working with prenatal clients, is to say, well, do you feel okay? And if they say they feel okay and I don't think it's a danger to them, maybe I would recommend them not to do it. But if I don't think it's a danger, then I would say, right, we're well informed. You're telling me, your doctor's telling you it's okay. You're telling me you feel comfortable. So my recommendation would not to be to do it, but it's your body.
I guess you've sort of done your due diligence as a teacher.
I have another question about, I guess it's a little bit of a scope of practice and a little bit of a different points of view. This one's around pelvic floor.
Yep.
Some schools of thought are that a normal yoga teacher who hasn't done extra training, even talking about pelvic floor, is out of their scope of practice. And that's actually not my own point of view. I talk about it all the time. But I know of many people who have done too much pelvic floor strengthening and not enough focusing on relaxing through the pelvic floor, who have had problems during their birth because they have only trained those muscles to engage and not to relax. What is your point of view of working with pelvic floor in pregnancy? And I guess your point of view of yoga teachers teaching about pelvic floor.
Yeah. Well, I think that there's a big difference between pelvic floor and Mula Bandha. They're totally different things. So, and traditional Mula Bandha with breath retention, particularly the retention side of things, it's inappropriate for a lot of, let's say, your once a week yoga student. Just not there yet, and that's okay. That's where they're at. And also for a lot of, for prenatal, that breath retention side of things is not helpful either. Too much intra-abdominal pressure increases blood pressure, so on and so forth. But pelvic floor is good, in my opinion, to work with, because that's a toning of those pelvic floor muscles and being really familiar with those. So going back to the point I made about if you were training for a marathon, you would be working on these sorts of things. It's handy to have established a really good connection to pelvic floor prior to pregnancy, during pregnancy. There's no reason why you shouldn't still be able to be accessing those in late pregnancy. And that's going to be really helpful for once baby's here. Even if baby's been born via a C-section, they still need to do some degree of pelvic floor, let's say, retoning. Yeah. So even if there's been no damage to pelvic floor during the birthing process itself, there still does need to be a concerted effort there to just re-exercise, to re-strengthen that area. But your point about the yoga teachers, for example, and I see this also in Pilates teachers and gymnasts and ballet dancers, where they're so used to containing pelvic floor. The Ashtanga yoginis are really key in this area. And I have not read anything scientific on this. I don't have any scientific studies to go on this. It's a lot more anecdotal. But those women who have very strong practices where core strengthening and pelvic floor tone is almost in that hypertonic state, then they do need to learn to let it go, because just like any other muscle, that muscle, those muscles of pelvic floor need to be able to move both ways.
Yeah, you wouldn't walk around with like your bicep flexed all the time.
All the time, no, exactly.
I
do. Yeah, it is. It's a really important one. So I don't know that there's a specific point in the pregnancy. I generally start to have a little bit of a one-on-one discussion with my prenatal ladies in the latter stages of third trimester, so maybe around that sort of 34, 35 week mark, to just say to them, just notice, can you move pelvic floor in the opposite direction? Do this with an empty bladder, always handy. Empty bladder, maybe do it when you're sitting on the toilet, but just feel like you can move those pelvic floor muscles forward and back. With the yoga teachers, especially the Ashtanga yoga community, ballet dancers, gymnasts, those sorts of things, I might talk to them about that a little bit earlier within their pregnancy, because again, I think that it's just an over tightening, and it can, again, this is all anecdotal that I've come across, but it may not mean that it's a really easy delivery.
Well, yeah, if those muscles are just really tight and you're trying to squeeze a baby out of there, that doesn't sound like it's going to be easy.
No. And we need to, when we've never done something before as well, most of us are, and even if you have given birth before, the second birth will be very different. The subsequent births will be very different as well. And, when we haven't done something before, we don't have a lot of information to go back on. Yeah. So we adopt our fallback state. And that fallback state might be to tighten because that's what we're used to doing.
And I think that's almost an unconscious response to tighten everywhere when you're in a time of an extreme time.
Totally. When you make no mistake about it, giving birth is stressful and it can be levels of anxiety around that. And when you're actually in the birthing state, we talk about that being actually quite a sympathetic nervous system position to be in. For good reason.
Yeah, if you've got to stay awake for like 23 hours or something.
Yeah, you want sort of, a lot of hormones circulating around, keeping you alert. But it's going to be helpful to then understand, let's say, that when I breathe out through my mouth and I make a long, soft ha sound, even if that's quite a loud ha sound, that's fine, or a vowel sound, they tend to be the ones that we naturally will adopt, even if you haven't done any training in those areas. If you're, a lot of women will just make that sort of low vowel sound through an open mouth. And there's a very strong correlation between a relaxed throat, a relaxed jaw, and a relaxed pelvic floor. Yeah, so if we have those two things together, which is why, we practice that soft ha sound through and then as we're working through, this is what I do in my prenatal, I start to talk with the ladies think about when contractions are peaking. And contractions is a bit of a misnomer really, because contractions are indicating the belly muscles of the uterine muscles contracting inward, but what's happening is that the cervix is opening. And so I ask them to try and think about opening of the cervix, opening of the mouth, softness in the throat, and those two things coming together as contractions are peaking.
I teach general classes, and I was just wondering, have you got any general strategies for, say, you're running a class in a gym and a pregnant person that you've never met before walks in 5 minutes after the class has started. Have you got any general strategies for working with that person and also, I guess, keeping the class at a reasonable level of challenge for everyone else in the class?
Yeah, it's just like if somebody else walked in the door with a back injury, for example, you wouldn't adjust the entire practice just for that one person, and nor would you do that for, your prenatal student either. So that's a massive question, really, Ron, because it's one of those, that's the tricky thing that all of us yoga teachers face when we're teaching a multi-leveled general class situation where we've got lots of different varying levels of experience and injuries or concerns and those sorts of things. So my overarching comment around that is that I want people to practice in a way that makes them feel good. If they're doing something which I think is a danger to them, or in this case a danger to the baby, then I'll make an adjustment. Mm-hmm. If I can, I'll definitely, depends on where, when they've joined the class, but if I can, I definitely will be asking them about any injuries, any concerns, anything relating to their pregnancy that I need to know about. And sometimes I'll have something that was there before the pregnancy. It could be a back issue or a knee issue or whatever the case may be. So we need to know a little bit about that too. So quickly getting some of that information. Is there anything that your doctor has told you not to do, or your treating medical practitioner or whoever else is supporting you has told you not to do? So if I get, where are you at in your pregnancy? So if I'm 12 weeks as opposed to, 25 weeks, my comfort level in working with that person is going to be different. First trimester, the most delicate time. So even though they may not be showing, unless they tell me, I may not even know that they're pregnant, and some women don't. Even, that happens as well. And I have teacher trainees get themselves a little tied up in knots, but what if they don't tell me? I'm like, well, you can't do anything if they don't tell you. Mm-hmm. Yeah, so but once they tell you, then you can be responsible.
So I've got a related question, which is an awkward situation. What if you think someone in your class might be pregnant, but you don't want to ask them?
Yeah, that happens. And, you particularly, yoga communities, we start to get to know each other really well, and you might hear whisperings of this, that, or, whatever the case may be.
Or just someone walks in and they've got a bit of a loose top on and they look a little bit round.
Yeah, breasts are their breasts are bigger. That's a really key one. I guess just like any other student, and in every single class that we teach, it's a good idea to do a check-in with the group either individually when they're checking in at reception or with the group as you close to the beginning of the practice, just to say, just remember, if there's stuff that has changed for you that I need to know about, give me a little wave and I'll come over and have a quiet chat with you. So I often ask that question when perhaps they're in child's pose or extended child's pose, heads down, everybody's eyes are, toward the floor. There's not a lot of looking around. So if somebody does have something to say, pregnancy not related, it doesn't matter. They can just pop their hand up, and most other people wouldn't even know that they've flagged.
I must say as well, this is more something I've done in a Pilates practice where there's so much abdominal work.
Yeah.
I will even say, now, if anyone was pregnant or had a neck injury, you wouldn't do this variation.
Yeah.
Here's another option for you. Or, I'd kind of just throw that prenatal contraindication in there with the other health issues I'm talking about, and then do a quick little scan around the room and see if they've gone for the prenatal option or not.
And and it can be that's a good way of approaching it too. And the other way that you can do it is that a lot of the prenatal options are very similar to, for example, if somebody has had abdominal surgery or they've got something going on in their belly, maybe they've had a gastrointestinal upset or they've got a digestive system concern like colitis or IBS or something along those lines, or even high blood pressure. So a lot of those prenatal modifications and suggestions are the same. So you might suspect that somebody is pregnant, but you could pop it together in a bit of a collective fashion. So for those of you who've got any abdominal issues going on, anything going on in your abdominal area, if you're a bit sensitive there, or for those of you who've told me that your blood pressure is a little high, here's the things that we're going to do differently. Here's option 1 is to do this, option 2 is to do that. And so, then it means that if somebody is taking that open belly twist instead of a closed belly twist, they're not big red lights over their head saying, hey, everybody, I'm pregnant, because they might not be ready to tell us yet.
I also teach at quite a few workplaces, and so sometimes people have told me before they've told the rest of their workmates. So for those people, I say to them at the start of the class, look, if I say I'm going to give a gentle option, that's also the prenatal option. That's for you.
That would be really tricky. I haven't taught in a corporate environment for a long time, but they're sharing information with you as a health provider because they feel that it's important, and then you have to be sensitive with that information. So that's just like when you're gathering information from current students or new students as they're booking in at reception, that you want to be sensitive to them and not you over there in the red tracksuit pants who's pregnant. This is totally inappropriate. But so having that little here's our cue. These are our signals, so they know that you're looking after them.
I do have one question that comes up all the time because it's the one pose that we pretty much do every yoga practice, and that's Shavasana.
Oh, yeah.
What are your favourite prenatal Shavasana alternatives? And do you have any that don't involve props for those workplace classes?
Oh, that's a good one. I think probably the easiest non-propped Shavasana alternative is on the side. Now, everyone talks about being on the left side in pregnancy, but sometimes depending on where baby is positioned, being on the left, like let's say, for example, their head's right up underneath your ribs on the left-hand side and then you lay to that side, that could feel really uncomfortable. You're not going to turn blue and explode if you lay on the right. It's fine. So be on the right. So that's easiest. That's the easiest option. The other easiest option, particularly if you don't have a lot of props, is to just sit against a wall. Sit upright against a wall if that, or even just sit upright into a meditative position. That's fine too. Yeah.
The young lady in my class, she sits herself up against the wall every class. So got that one covered.
Yeah.
I do know you've got your pre and postnatal workshop coming up. Would you like to talk about that?
Yeah, that's lovely. Thank you. So we've been really focused at AYA in terms of putting together programs that are really focused on continuing professional development for our already established teaching community. So I think foundation level teacher training, there's lots and lots and lots of that available. But once you are already qualified, then, if you have a special interest, where do you go to and what do you do and who do you work with? So I've been thinking for a long time about putting together a dedicated pre and postnatal advanced training together. And so I have finally done that, and it's recognized through Yoga Alliance. So it's a 50-hour program. So it's 6 full days, and it's going to be, something that really covers, all aspects of pre and postnatal.
And is that aimed more at people who want to specialise in pre and postnatal yoga, or do you think anyone who's interested in sort of developing their teaching will want to come to that?
I suspect that it will be the former, that it would be something that would attract the people who really have an interest in working with women, mostly in that prenatal capacity. But I'm getting a lot of interest in the dedicated postnatal space, which is quite interesting, because I think that's really an area that most people ignore. We just assume that once baby's here, everything's back to normal, and that's not necessarily the case. So I suspect it's going to be mostly people who are looking for prenatal, but it's anyone who's teaching students, and most of us teach our prenatal students within a general class setting. So I hope it's going to be valuable for them too.
I'm sure it is, and I've been to some of your prenatal workshops in the past, and they've been very helpful for me, and I guess alleviating the anxiety I do feel when a young pregnant woman comes into my class. So yeah, I can definitely recommend it.
Oh, thank you.
I must say as well, the options that I've learned in prenatal trainings have really been helpful for other health issues.
Totally.
Like things like vertigo or high blood pressure. Like you already have these options in mind. So even if it's not an area that you want to specialise in, it's a really great way of just building your toolbox of different alternative poses, no matter what people have going on.
Yeah, I think that's a key challenge for us as yoga teachers, especially when we are working in general class situations and you have so many different levels and so many different issues that people are dealing with. So, just being, what's the word? It's almost like practicing coming up with alternatives pretty quickly. Sometimes you really have to think on the spot, as you both would know, especially when someone halfway through the class says, I forgot to tell you about my sore back, knee, whatever the case. Okay, all right, let's find, or that I'm 15 weeks pregnant. I'm like, okay, right, let's do this instead. So yeah, it can be really helpful just to have those different options in our toolkit.
I guess to close things off, if you could distill everything you've learnt and everything you teach, and this can be about pre and postnatal yoga or anything in general really, if you could distill everything you've learnt or teach down to one core lesson, what do you think that thing would be?
Oh, it's such a good question. It's such a hard one to answer. I think the biggest thing that has changed for me over the course of my teaching, so when I said it earlier that my background was very much from an Iyengar space, and as I said, they tend to be quite rigid and quite specific and so on and so forth. And lately my teaching has moved to that felt sense, to understanding and coming at our practice and coming at our teaching about how does it feel. And I read some beautiful quotes by Desikachar actually. So Krishnamacharya's son, Desikachar, who said, and he was quoting his father as well, and he basically said that we have to remember yoga's for the self. It's not about me as the teacher. It's not about the group of 30 or 20 or however many people are in your class. It's about that particular one person. And so that's really where I feel our power and benefit and the beauty of being, the privilege that we have in working with students is that it's all about them and their experience, and we're just merely a guide.
Beautiful.
Oh, thank you so much. That was lovely.
Thank you.
Well, thank you so much. We had to skip a few questions because we're out of time, so we could clearly have spoken for much longer. So thank you so much for sharing all your knowledge with us. It's been great. Thank you.
I very much appreciate being here. Thank you.
Oh, thank you.
All right, and that was our episode with Mel. I hope you got a lot out of it. I know I did. And again, if you'd like to know more, you can find out about Mel's workshop in our show notes at podcast.flowartist.com. So head on over. On a side note, Joe runs a baby's welcome class at our studio, Garden of Yoga, on Wednesday morning. Now, it's not a mums and bubs yoga class, but babies are welcome, and we've been witnessing some extreme cuteness at the studio, so why not join the cuteness? We'd love to see you there. So, big news. Our next episode is episode number 50. Yes, our 50th full-length episode, and we have a great guest, Jivana Heyman. Jivana is a US-based yoga teacher, yoga therapist, creator of the accessible yoga conferences all over the world, and author of the forthcoming book, Accessible Yoga, Poses and Practices for Every Body. Accessibility of yoga is a subject that is really important to Joe and myself, so we think that Jivana is the best possible guest for our very special 50th episode. Alright, so as usual, our theme song is Baby Robots by Ghost Soul and is used with permission. Get his music from ghostsoul.bandcamp.com. Thank you so much for listening. We really appreciate it. Aroha nui. Big love.